Hi, I'm Dr. Fred Echols. Welcome to this week's Ask Dr. Echols segment. This week's questions came from members of the Mark Twain Neighborhood Association. Question number 1, how would you recommend dealing with large gatherings at homes at this time in the pandemic? I've witnessed more and more of this in our neighborhood, and a lot of the individuals are not wearing masks. Accurate information is the key to assisting individuals with changing their knowledge levels, their attitudes, and their behaviors. Although it may be difficult to reach some people, most people will do better when they know better. The ultimate goal of public health education is to empower people in a way that gives them the insight needed to adjust their decision-making knowledge, attitudes, and behavior in positive ways. The City of St. Louis Department of Health encourages helping those individuals get accurate information. Question number 2. How can our neighborhood association help the city in its efforts to slow the spread of coronavirus? The City of St. Louis Department of Health would love to have City of St. Louis neighborhood associations assist the department and our other public health partners in distributing accurate information to your association members and the community at large. We will be happy to add you to our listserv to receive COVID-19 updates and other public health related information. Once you receive that information, it will be a big help if you share it with your networks. Question number 3. Is there a quarantine requirement for people arriving in the city? There is ongoing widespread transmission of COVID-19 within the United States, including here in the St. Louis region and in many areas throughout the world. If exposed to COVID-19 when traveling, you and your travel companions, including children, pose a risk to your family, friends, and the community for 14 days after you were exposed. For this reason, we ask all persons that travel who do not consistently implement the measures needed to prevent the spread of COVID-19, such as wearing face coverings, physically distancing themselves from others that do not live in their household, and washing and sanitizing their hands regularly, to quarantine for 14 days after returning home. This will help reduce the likelihood of spreading COVID-19 to others if you are infected. Question number 4. What are the current COVID-19 case counts looking like? For the most up-to-date information on the COVID-19 case count in the City of St. Louis, visit stlouis-mo.gov/COVID-19. The good news is that we have been seeing an encouraging decrease in total daily cases being reported. However, we're not out of the woods yet. More cases are still being reported every day. As we continue to examine the city's data, some concerning trends are being revealed. For example, area code 63116 and 63118 in the southeastern part of the city had the highest number of COVID-19 cases in the city. Early in the pandemic, we were seeing the elderly living in congregate living facilities like senior centers and long-term care facilities being disproportionately impacted by the virus. Over the past several months, that has changed. Younger individuals ages 20 to 39 make up the largest percentage of patients being infected. Young people between the ages of 10 and 19 is a group we are watching very closely as schools begin discussions again related to in-person instruction. Thank you for tuning in this week, and a big thank you to the members of the Mark Twain Neighborhood Association who submitted questions. Be sure to tune in next week for more critical public health information. I want to hear from you, St. Louis. Please send your questions to health@stlouis-mo.gov. Questions will be answered in the order they are received. If I run out of time on air, your question will be answered by return email. Be well.